I've got 2 minutes to help you with your tennis elbow. Tennis elbow is defined as inflammation or irritation to the tendinal origins at the lateral epicondyle. This is why it's often termed lateral epicondylitis. Now, itis is somewhat of an outdated term where it implies that there is inflammation or infection, and we now know that you can have pain without elevated inflammatory markers. Treatment of tennis elbow involves calming things down and then building things back up. In the early phases, I like to use soft tissue and light mobility exercises in order to increase blood flow to the tendons and decrease symptoms, decrease tightness, just to allow for a decrease in pain overall. After the initial phase of calming things down, we can begin to slowly build things back up and increase these tendons' capacity to handle stress. I want to start out with isometrics because I think this is fairly tolerable for most people. I like this manual wrist eccentric isometric where you can perform with minimal to no equipment. You can then move on to more concentric and eccentric based lifts, such as this eccentric dumbbell, which is good because you can actually apply the progressive overload principle and increase the amount of weight that you're doing over time. I also think it's important to strengthen the shoulder girdle, particularly the delt or lateral delt in tennis elbow, because when you hold something at the end of your hand and you are performing a movement out to the side, such as the common overuse injury with tennis elbow, it's not in isolation to these tendons in particular. Yes, they're receiving strain, but your shoulder does carry some of the load. And if you have weakness in the shoulder or poor stability, you can actually provide excess strain on these tendons. Thanks for listening to me talk about my brief description of tennis elbow. If you have trouble or would like self-guided programs, please visit my website or the link in my bio. It's www.rhpmobilehealth.com and navigate to the online health and longevity membership. Thank you.